Tom McCarthy, Managing Partner at KAF Wealth Management. You are a finalist in the Community Service category for the 19th Annual Invest in Others Awards. Which charitable initiatives are you most actively involved with, and why have you chosen to support those initiatives?
Thank you, Chris. I've been involved with South Shore Health, which is a large regional medical center located about 20 miles south of Boston. It's a very important part of our region. We serve about 1.1 million people in this area. I am very fortunate to have become involved with this going back to 1997. At that time, my very first client was someone who was stricken with cancer. And after he passed away, his wife asked me if I would get involved to help raise money in his memory in honor of the hospice program that he had received care from at the end of his life. And so I did. And through that process of meeting people at the foundation of South Shore Health and raising money, I ended up becoming a trustee of the foundation over a few years. And then through first serving on different committees, I then became the chair of the foundation. And through that process, over several years, I got to work with many incredible people, healthcare workers, administrators, people in this facility. It's really quite impressive what is done there on a daily basis. There are over 6,000 employees there. As I said, they serve 1.1 million people in this region. It's a level 2 trauma center. It's known for its OB program, for cardiac, for neurology. We built a cancer center there several years ago in collaboration with Dana-Farber and Brigham and Women's Hospital. It's just an amazing place. And the stories that come through the door every single day are incredible. It's very important, for me, that one of the missions is to provide quality health care to anyone. We are a charity. We are not a for-profit organization. So therefore, anyone who walks through that door, comes through that door, whether through an ambulance, whether of their own 2 feet, we provide care to them. We don't interview them and ask questions up front as to what station of life they come from or how they're going to pay. We just have to be ready and able to care for them in the best way possible. The charity was started over 100 years ago by Dr. Emerson, and he was putting his wife on a trolley to go into Boston, for her to go into Boston to give birth. And at that point, he realized that that's really not the way that healthcare should be treated. You shouldn't be taking people at their most vulnerable and putting them into a position like that. So he endeavored from that point forward to be able to provide care for people in the region and his neighbors. And 100 years later, although things have changed quite a bit and we're much bigger, our mission is really the same. I mean, we are trying to provide good quality care to everyone around us. For me, and although I've been doing this for many years, it became much more personal for me about 4 years ago when a routine MRI that I was having turned up that I had a nodule on my lung, which shockingly turned out to be lung cancer. And so therefore, I now moved from being a volunteer to being a patient. And through my work at the foundation, and then beyond that, I became a member of the board of directors, and I'm now the chair of the board of the health system. But now for the first time, not just a volunteer anymore, but I'm seeing it as a patient. And so through that process of going through and having the benefit of a Dana-Farber Cancer Center on our campus and being able to be seen and treated and to come through that whole situation and to come out on the other end and to be 4 years past that and to be cancer-free is, again, I'm seeing it through my own lens and through my own eyes, but now I really understand it even that much better than I did before. So I know that, there are many people that choices that people have for healthcare. Again, we are just 20 miles south of Boston. So therefore, we're known around the world in this region to having good quality healthcare. But for us, we don't want to be having to go into the city all the time to get that care. We want to be able to, if someone has a trauma, if someone has a car accident, if there's something that goes on, you don't want to be having to travel far distances for that. You want to be able to get care locally. And that's really what our mission is. And we try to continue to do that. Healthcare is a very challenging field between the reduction in reimbursements from the government, from insurance companies, the rising costs of healthcare. It's challenging. And so that's one of the things that we struggle with is to how to continue to do that and remain as an independent health facility, which is what we are. So we've been making great strides. We continue to grow. We continue to provide the level of care that we know is important. Our quality is extremely important to us. We want to make sure it's the best care that people can get anywhere by coming to us.
Tom, that is a very worthy cause and a very personal one as well. Now, Invest in Others focuses on charitable initiatives by individuals in the wealth management space. With that in mind, can you tell us a bit about your business?
Yes. So KAF Wealth Management is a firm that was founded quite a long time ago. I mean, I've been doing this since I graduated from college. I was fortunate enough to join this firm and then be able to continue to help it grow. We focus in working with privately held business owners and individuals in full service wealth management. We to try to help people at all aspects of life when it comes to their financial life. We see them go through the startup of companies, the growth of their companies, the growth of their wealth, and then the eventual distribution of that wealth. So we have a full team here. We have about 40 people at the company. We focus in on all of the various aspects of planning, whether it be estate planning, asset management, all the way through to retirement planning. We try to be a one-stop shop for all of our clients. We want them to be coming to us so that we can, on a coordinated basis, help them. A lot of our business is in the New England states, but we do work across the country. We're very fortunate to have a client base that continues to grow up and down the East Coast and even moving further west. And very loyal clients that we're very appreciative of.
Tom, thank you very much for your time.
Thank you, Chris.